This is Average Joe PT. Now this episode we're going to talk about hip injections. Is it worth getting one? What are some of the side effects of a hip injection? And am I really going to get some help with one? So go ahead and stay tuned. When we talk about having a hip injection, there's really three things you need to think about. One of them is, what's my benefit from it? What are the side effects of it? And how bad is it going to hurt after I get it done? Those are three things that mostly go through people's heads. They've been suffering with this hip pain for probably weeks and weeks and weeks and weeks. They've probably had oral medication, pain meds, anti-inflammatories, maybe some prednisone, steroid pack of some sort. They might even gone to physical therapy, been diagnosed with a bursitis or tendonitis, and it still hasn't gone away. So benefit number one really is you're getting that steroid into that specific spot that's giving you that pain. It's usually a combination of the bursa and the actual tendon itself. Number two, you should expect at least some relief after about 72 hours because it's been inflamed. You're sticking a needle in that spot. No matter how much they've numbed it, it's still going to hurt once that numbing agent wears off. But give yourself about 72 hours of icing that hip area and then start to see some significant benefits from it. And number three, that's right, you should see some benefits after that 72 hours of reduced pain with walking, being able to sleep a little bit better at nighttime, and have improved range of motion in that hip. When we think about the hip itself, 1 out of 3 is what you should be talking about. And what is 1 out of 3? For every 1 pound you're overweight, is 3 pounds of pressure on your hips. Now I talked about in my last video, if you want to go and click on that, that's specifically about the knee in relation to weight and reducing pain with walking. And this episode, we're talking about the injection of that hip. But if you can reduce that weight in that area just by simply walking a little bit, 15 minutes out and 15 minutes back, or look at one of my videos, I'm going to leave a card up there to look at, and how you reduce pain in your home with the hip and different types of treatment techniques. Now there's all kinds of videos on the internet talk about exercises, stretches, and the reality is until you get that inflammation to calm down in that hip, you're not going to be able to tolerate any of those exercises in the first place. And specifically, it's the hip lunge stretch. I'm going to go ahead and leave a tag right up there that you can see. There's probably 1,000 videos specifically on that hip stretching exercise, and they don't tell you what you need to be able to do first. They show you like, oh yeah, do this hip stretch exercise and your pain's going to be magically gone. Well, they're not really telling you the truth, which is you got to reduce the inflammation in that bursa and in the tendons around that hip before you can even think about doing that exercise. So stick around just a little bit more. I got some other information about injections of the hip that you're going to want to think about and hear about. So stay tuned. Injections themselves are quite interesting. You can have them anywhere in your body, and we're talking about in this episode all about in that hip. Now, when it comes to specifically this hip injection, there's a few other things you should think of. Why were you having that pain in the first place? Was it just something chronic like that bursitis tendonitis? Or was it from a fall? If it was from a fall, the injection really works quite well. If it's not from a fall, if it's chronic in nature for some other reason, that injection's only going to work for a very short period of time, and then the pain's going to start to return. I would give it probably about a week or two, and that pain's going to slowly start to creep back in again. And there's several reasons why that can happen. One of them specifically is just the stress around this joint. I talked about earlier that 1-to-3 ratio. For every 1 pound you're overweight, is 3 pounds of pressure on that ball and socket. So let's say you're 100 pounds overweight, that's 300 pounds of extra pressure on that cartilage, and it can't continue to take that forever. Once that steroid starts to wear off that doctor injected that hip with, your pain's going to start to return. That's telling you that one, it really is an inflammatory process that's causing all your pain in the first place. So for the physician, that's a nice diagnostic tool to utilize. But also number two, there's something else going on that's causing that pain to come right back again. And usually it's one, weight. Two, could be some weakness around those hip muscles. And I have a few videos up in there that talks about once you get the inflammation to calm down, you can actually get some exercises involved. And so go ahead and click up on those cards, and they'll go ahead and go over some exercises to strengthen that hip so you're really not stretching that ball and socket as much as you used to. If it was an activity like walking, too much of that, like inclines or declines, maybe you're out doing a lot more of that than you normally do, that can obviously, once you stop that activity, that injection can help that. Like I said before, fall. If you're calling what I call the weekend warriors, where you do a lot of outdoors activity, maybe yard work, and that kind of started to precipitate the problem. If it's a foot problem, let's say you have flat feet, I have videos on the ankle and foot that can go over different types of taping techniques, footwear that can help reduce your hip pain is because you're having some foot alignment issues. So you can go ahead and look at those. So there's several different reasons why after that injection, you start to have some pain again. So I want you guys to stay tuned just a little bit more, and we're gonna go ahead and talk about one more thing. So stay tuned. We talked about several key things in this episode. We talked about injections. Are they gonna help you or are they not going to help you? Why will they or will they not help you? And what's the overall benefit over a period of time to having those injections in the first place? Now, I have all types of videos on here. I would love to have you subscribe. Try and bring this content to you, a couple times a week. If you guys have any questions, positive or negative, go ahead and leave them down below. But until next time, Scully and I always like to say, look up and keep smiling. See you next time, folks.